Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube channel. This meeting is being interpreted in American Sign Language by Kim Rich, and Carlos Saraceda is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude the press conference. As we head into the weekend, it's important to remind everyone to please continue to be smart about where you choose to go outside. Please have a couple backup plans or alternate times in mind if your first choice already has too many people gathered. Remember to continue to follow the simple personal steps we all need to do to prevent the spread of COVID-19. Stay at home as much as you can, wear a face covering at all times when you go out, and stay at least 6 feet away from other people when outside or around others. Wash your hands regularly, don't touch your face, and disinfect surfaces. And if you feel sick, isolate yourself at home. If your symptoms worsen, call your medical provider or the county clinics and follow their medical advice. There are many other important ways for community members to help out during this time. The county's created an online portal for volunteers to sign up to offer their time and skills to help out the many community organizations that are doing important work helping others. Volunteers are being recruited to help out at food distribution sites, homeless centers, call centers, medical sites, and other locations. On the volunteer registration form, you'll be asked to describe your own personal experience and expertise so that you can be offered meaningful assignments. Safety is the county's highest priority. Every volunteer will be provided with the necessary personal protective equipment. I'd like to sincerely thank the community members who have already signed up to volunteer. To register, please visit publichealthsbc.org/resources. That's publichealthsbc.org/resources. All volunteers will be sworn in as disaster service workers. And if you feel called to support vulnerable individuals in our community during this time, please join us. We'd be so grateful to have you on our team. In the spirit of giving and volunteerism, I've seen both local and national reporting discussing how blood donations have dwindled as the COVID-19 outbreak continues. Donating blood is essential to community health, and the need for blood products is constant. Just one donation can save up to 3 lives. Blood donations are regularly needed for cancer patients, people with sickle cell anemia, accident victims, and other emergencies. To keep the supply lines open and prevent a secondary healthcare crisis from developing, please consider donating blood. In response to COVID-19, the Red Cross has developed systems to provide a safe environment for blood donors. So again, please consider contacting the Red Cross at redcross.org, or call 805-687-1331, 805-687-1331. Finally, I'd like to highlight the incredible work of the Santa Barbara Wildlife Care Network. As their executive director, Ariana Kotovich, recently said in a letter to the community published in the Santa Barbara Independent, unfortunately, wildlife hasn't gotten the memo that there's a pandemic forcing new protocols on us all. Last year at this time, I visited the Santa Barbara Wildlife Care Network to see firsthand the annual deluge of orphaned wild baby animals they help. The dozens of ducklings, baby skunks, baby opossums arriving require warmth, nutrition, medication, and around-the-clock care. The Wildlife Care Network normally relies on its army of hundreds of volunteers to care for the animals, but this year is obviously different. To adjust to the new reality of COVID-19, the Wildlife Care Network is adapting and going back to its roots by helping care for these animals from their own homes. Volunteers chop up fruits and veggies at home and deliver them in neat packages ready to go for the animals. The animal care staff are all working maximum hours with masks and gloves to care for the animals. We're just now at the start of the baby season, and right now there's maybe about 20 animals arriving each day. As spring gets going, up to 60 animals will be arriving each day. Wildlife care is a community effort. The generosity of donors and volunteers makes this work possible. Animals would not be given a second chance at a wildlife without a network. They need help to make this happen. For this reason, the Santa Barbara Wildlife Care Network has started a fund for baby animals to help rally our community around loving and caring for wildlife. Anyone can make a donation or volunteer by going to their website at sbwcn.org, sbwcn.org, Santa Barbara Wildlife Care Network.org. If you find a wild animal in need of help, please call the Wildlife Care Network at 805-681-1080. My favorite quote from Ariana's letter to the community is, "Wildlife rescue and concern for animals displays the best of humanity and our shared connection. I wholeheartedly agree and hope you can help them with this important mission." I'd now like to introduce Dr. Vaughn DeRenoso, the county's Public Health Director.
Thank you, Supervisor Hart. Good afternoon, everyone. Today, we are reporting 19 new cases in Santa Barbara County, which brings us to a total of 373 cases. 6 of the 19 new cases are related to the outbreak at the federal prison in Lompoc. Of the 373 cases, 157 are recovering at home, 43 are hospitalized, and of that number, 14 are in the ICU. 152 have fully recovered. The ages of the new cases range from under 17 to over 70 years of age. The ongoing outbreak at the federal prison is a very serious concern to the Public Health Department. Currently, we are reporting 80 cases of COVID-19 in persons that are incarcerated and 30 cases in employees. Today, we also have a key member of our staff here with us, Nick Clay, to discuss the status of our work with the Bureau of Prisons. We remain committed to ensuring access to needed health care and healthcare information for all communities in Santa Barbara County. We have been working closely with local community organizing groups through a task force that ensures linguistically and culturally appropriated access to COVID-19 resources and messages, in particular for our Latino and Indigenous communities. Our epidemiology team continues to work through the collection and analysis of our local demographic data, which will include information about race and ethnicity of those with confirmed COVID-19 in Santa Barbara County. We're finalizing the data and will be presenting the report to our community during the Board of Supervisors meeting next Tuesday. In closing, I'd like to thank every single community member that has paused before leaving their home to grab a face covering, every person that has remained mindful of their physical distancing when at the grocery store or at their local park or at the beach, everyone that has opted for a video call rather than an in-person visit or meeting. Your singular actions are making a resounding difference in flattening the COVID-19 curve in Santa Barbara County. Thank you.
Thank you very much, Dr. DeRenoso. Next, we'll hear from Nick Clay, the Emergency Medical Services Director for the county's Public Health Department.
Thank you, Supervisor Hart. I want to start by acknowledging the long history that we have with working with the Bureau of Prisons, specifically the Lompoc Federal Corrections Complex, on various public health initiatives. They continue to be a valuable and willing partner in managing the challenges presented by the COVID-19 pandemic. Public Health has been working with the prison on this challenge all along the way. We are supporting the Bureau of Prisons' management of this challenge. To do that, we have a three-pronged approach to support the prison's efforts. First and foremost is monitoring. For the past week, we have partnered with the prison to offer staff symptomatic staff testing for COVID-19. Secondly, we are working with disease management and modeling. We have dedicated staff tracking the outbreak at the prison. We continue to work on modeling with draft estimates showing numbers that continue to grow over the next few weeks. As modeling gets refined, this projection may change. Additionally, we are consulting with prison leadership on how to identify opportunities to flatten their own curve. but given the layout, this is a challenging scenario, even with the best mitigation efforts in place. And last but not least, we are working with medical management. There are hospitalized cases. However, we are working with the Bureau of Prisons to support the development of an on-site medical facility to better support the prison and reduce the challenges presented with the movement of inmates back and forth to hospital locations. There has been significant movement over the past week on this project, and we hope that the Bureau of Prisons will be in a position to have the facility stood up in the immediate future. I'd like to close with again recognizing the Bureau of Prisons as a great partner in this effort, as they have been engaged in the management of the issue. Additionally, the Public Health Department, along with the Unified Command, have been in near daily communications with the Bureau of Prisons, the California Office of Emergency Services, FEMA, the California EMS Authority, the hospitals, local, state, and federal legislators, and various other federal partners. Thank you.
Thank you very much, Nick. Next, I'd like to introduce Suzanne Grimacy from the county's Department of Behavioral Wellness.
Thank you. Good afternoon and happy Friday. Another week has passed and much has happened, including being on the other side of Passover and Easter. I think this year's spring holidays brought a pleasant surprise for many. What we know, in fact, showed itself very powerfully. As humans, we are simply wired to be connected. These important holidays found themselves to us wherever we were, despite the barriers in place this year. Despite no family gatherings that were large, no egg hunts in the park, no church services in person, barbecues, or restaurant brunches, whether we were alone or with immediate family, people strongly connected in very simple ways. Amazing to watch. Now, here we are, over a month of living differently and with so many challenges and changes that have consumed our lives. We are being exhausted in whole new ways. Kids are stir crazy at home. Parents are feeling the stress, loss of wages for many, and small businesses wondering how they will survive. There is no doubt a temptation to cheat social distancing. Backyard barbecues, beaches, play dates. Some are beginning to assert that it is their right to do these things. While there's no question of the needed stress relief that could be gained from these activities, these things are not worth an elderly neighbor, a coworker, or a family member losing their life to this virus. We simply must stay the course. We must stay at home, practice social distancing. If needing to go out, we must support the safety guidelines of essential businesses who are trying as hard as they can to make sure their staff and customers are safe while staying open for the community. We might pause and think, who are you staying home for? Who are you in your life staying the course for? Keep in mind that this is not forever, and every person really is making a difference, and it's working in our community. Especially exciting as we now enter a new chapter, beginning to look at the transitions to a new normal and using the governor's 6 points as a guide. We can't let our guard down now. We need to stay the course, and together we can do this. Remember to take care of yourself, take breaks from watching media, take care of your body, take time to unwind, to get outdoors, and connect with others. The Community Wellness Team remains available to get connected to mental health resources or just to talk by calling 805-364-2750 or by visiting the website at sbccwt.org. Thank you.
Thank you, Suzanne. Always appreciate your messages. We'll now go to questions from the room. Mr. Fish?
I just have a question regarding the third death in the county announced yesterday, a patient in the South County under hospice care. I just wanted to know what the concern level might be for other hospice patients to potentially be infected by either that individual or by whoever infected that individual who was already in hospice care?
So our disease investigation team looked into the incident, and we have no concerns at this time.
Is there any information you could elaborate on or share in terms of how this person already in hospice care may have
I
been
wish I
infected?
could, but out of respect for the person's family and their privacy, I can't disclose more.
Thank you. And then just a quick question for Nick regarding the prison. Could you just elaborate just a little bit about what specifically the structure of the prison and the layout or whatever it might be that makes it specifically difficult for leadership to flatten the curve there?
Sure, I can speak in generalities with regards to the prison structure. Essentially, it's a congregate living scenario, so it's where it's many folks living in one area. Just like you and I have the opportunity to go home and maybe stay in our bedrooms if we're not feeling well, or stay away from loved ones and family members, that option is not necessarily there in many prison environments, but certainly this prison environment. So that lack of ability to really separate from one another and really have that true social distancing that we all are practicing every day just doesn't exist in a facility such as that.
And then just a quick follow-up on the medical facility that's seeing significant progress there, you're saying. Could you just elaborate the immediate future you were talking about, when that might be up? Is that looking like in the next week or so? And then, how big would this facility be? How many patients may they be able to see there?
Certainly. So we are certainly hopeful. I would hate to put a date on it and then have it go beyond that. I think we'll know more early next week in terms of an actual finite time and when that facility will be up and running. With regards to capacity, it's sort of a two-pronged or two-phased approach. We have an immediate hope that they'll be able to stand up the ability to care for upwards of about 24 patients. And then as the need potentially grows, there's the additional capacity to grow that beyond that. So certainly hopeful for 24 and hopefully that we'll know more in the early week.
Thank you, Mr. Dreyfus.
Yeah. How big of an impact will the outbreak at the prison have on reopening, or the, plan to reopen more businesses and, let people out of their houses?
Dr. Reynoso?
That's a complicated question. At this time, I think our focus is on mitigating and supporting the prison and the leadership in that containment. And I think that as a county, we have to take into consideration all the 6 initiatives and our readiness to meet the governor's 6 initiatives before we can think about lifting.
Follow-up question on that. Is there going to be an investigation on how this outbreak started in the prison and why nothing was contained early on? Or is there any answers on how this got out of control up there?
I would say that again, right now we're in the middle of a situation, so our focus is supporting the prison leadership in the containment and making sure that it doesn't go further or that the growth is linear rather than exponential. So that's been our focus. And as Nick alluded to earlier, we have an astounding partnership with the prison leadership. That we are lockstep in supporting them, and they are very open to guidance and following them. So they have a really good staff, good leadership, and this is a partnership in terms of the disease containment.
Okay, and with the release of prisoners, is there any sort of testing that's happening if a prisoner is released? Are they tested before they're released? Is there a process on releasing some of the nonviolent offenders, and how does that work?
I believe that the prison has a process in place where there is a quarantine of 14 days where the inmate is monitored for symptoms, and at that end of the period, the decision is made on the readiness for release.
Yeah, are there any other questions in the room? Next, we'll go to the phones.
Yes, first up, we have Santa Maria's son. Malia, go ahead.
Hi, I'm just wondering if the county jail has had any confirmed cases that you're aware of.
Yes, we are aware of one confirmed case in the county jail, and our disease control team is in the middle of the case investigation. But from with what we know currently, we are astounded by the great job that the jail has, their quarantine protocols. We are truly amazed at the protocols that are in place. We are looking at every possible exposures, and we're not, at this moment in time, we're not worried. It seems very unreal, but a huge applause to our sheriff's office for the excellent quarantine protocols that he has in place.
Are there, to follow up on that, are there any leads as to where the case might have come from? Do you believe that it was someone who was new to the jail who had brought it in, or that it might have been passed through staff to the inmate?
Since we're still in the middle of the case investigation, I could update you the next time we have a press conference, but we're still in the middle of the case investigation.
All right, thank you.
Next up, Tom Bolton, News Hawk, go ahead.
Hi, good afternoon. I have two questions. The first one for Dr. Del Reynoso. Following up on the fatality, we were advised by Dr. Ansar yesterday that that person was already in hospice care. But I'm trying to understand, or it was classified as a COVID death. So are we to understand that that person's, presumably who was already terminal, their death was hastened by coronavirus, or I'm just trying to understand the circumstances there.
I don't have that information, unfortunately. I know that he was in hospice care and that he did test also positive for COVID-19 at the time of his death.
Okay, it seemed like that's kind of important to know. Anyway, also a question for Nick about the prison. We had more than one report from families of inmates saying that staff members were not taking appropriate precautions in terms of masks and gloves, that the availability of cleaning supplies and disinfectants was not adequate. Have you all been able to make an assessment of how they're doing in that regard?
Yes, so we were on site earlier this week, and I can tell you during our meeting, we were all wearing masks. And it's certainly in looking at the facility, they've handed out cloth masks and PPE to all of the inmates as well as the staff who may need it. And they were pretty well underway with a lot of their PPE and cleaning supplies. So based on what we were able to ascertain on Wednesday, it looks like they've taken appropriate measures with regards to that.
All right, thank you very much.
Next up, Raisa with San Ynez Valley Star, go ahead.
Hi, everyone. Thanks so much. And I am wondering, this question is for Ms. Reynoso. If you've read any of the reports that are coming out of Santa Clara County that they're looking like they're testing 85 times more than positive, more than what they originally thought, and how that, how that maybe applies to our situation here. Santa Barbara County has a high volume of tourism from China specifically. And, if you're thinking that the start dates might have been skewed, I know I've been asking this from the beginning, but how certain are you of the start date and testing efforts? What's happening with that?
So I know at the start date, we can tell by when we received our first confirmed case, and we can estimate as to when that infection period started. With regards to testing, that is something that is of great concern to the Public Health Department as well as our healthcare partners. We have stood up a task force where we are assessing the community's readiness should more tests become available and we test more broadly. So that is one of the priority areas of the Public Health Department as well as the healthcare community.
Right, I understand about, this, your start date is by the confirmed case, but I just am having a hard time really thinking that that is the actual start date. And if, how hard are you guys pushing to get this antibody testing? What companies have you been talking with? And, how soon are they looking to get testing available here in Santa Barbara County?
So you may have heard about the Stanford and Sacramento Task Force.
Yes.
And so we are informed, we are updated by that task force. And the guesstimate is that by the end of summer, middle of summer, that the serology testing will become available. And so we are just as anxious as the next county to get our hands on the supply when it becomes available. Locally, we are exploring opportunities when it presents ourselves to look at local biotech companies and the feasibility of doing something locally and homegrown as well. But those efforts are purely in the exploratory phase right now.
Okay.
I'd just like to add to that, Reza, that there is a lot of talk about this on the national media, and people are excited about the prospect of this, but this is not something that is a soon product. There are very few tests of serology that have been approved by the Food and Drug Administration. I think there's only 3 that are available, and the work that is being done is experimental at this phase. To go from that phase to mass availability that would help us in this moment is going to take significant time to happen. So the idea that this is something that is imminent, that's going to be an effective tool to help us, is still a long way away.
I agree on that one. I'm just wondering, I understand that the start date happened when it was confirmed, but I want to know, from your own personal experience, do you actually believe that that is the start date? And they say that the first case popped up November 17th in Wuhan, and they didn't close travel from China until January. So the likelihood of it being here in California is high in my guesstimations. I just wanted to know if that was your thoughts as well.
I can say that without further evidence or data that in likelihood the coronavirus at that time could have been present. But again, the testing really didn't begin till February. So in likelihood, there may have been mild cases, but without evidence, I'm uncertain about the firm start date of when that may have been present in our community.
Okay, thank you. Happy.
Sorry, Reza. Thank you so much. Next up is Nick Masuda with Santa Barbara News Press, who will be followed by Nick Welsh at Santa Barbara Independent.
Thank you. Supervisor Hart, I think this is probably directed to you. As we've all seen, some states are starting to loosen the reins a little bit, and we're starting to see pockets and groups of people starting to protest about, loosening those reins in different spots, including one in California today. If that was to happen here, have discussions been with the Sheriff's Department and the PD about what would be done to contain that?
That's a great question, and I have not been privy to those kind of conversations. I'm sure that our local law enforcement officials are ready and able to manage a situation like that. I think the most important message that I'd like to communicate to the public is that, the differences of views and the concerns people have about the situation that we have with COVID-19 are important to express in a positive, constructive venue. The Board of Supervisors has an update every Tuesday. More than happy to hear public comment about those kind of issues. We want to understand what people feel about this. But, you know, the idea of having a mass demonstration in the middle of a public health crisis and a pandemic is extremely irresponsible behavior and should be discouraged in no uncertain terms. That is not going to help us get a hold of this virus, and it is not going to get us faster to getting the community opened up. Again, we want to hear from people. We'd like to hear, you know, different views about how that should be done and how fast that should be done. That's absolutely appropriate. But a public demonstration involving a lot of people is exactly what we do not want to have happen right now.
Thank you.
Thank you, Nick.
Nick Welsh, go ahead.
Hi, this is really Jean Yamamura. I have to use Nick's computer though.
Hi, Jean.
Thanks, guys. So regarding Lompoc Prison, my recollection is first we heard there were 17 and then 30 and then 80 and now 110. Do you guys have an idea of maybe 1 week, 2 weeks down the line, what we are looking at in terms of the 24 beds you're thinking of? Might you possibly need more? My second question is in terms of public health, you know, Newsom has laid out his ways to alleviate the shelter in place. But as far as testing goes, for the county, I mean, at what % would you feel that testing is sufficient? I mean, Los Angeles County today is just unveiling a sputum test for anybody with symptoms. It's a drive-through test, and presumably it's an RNA test, the gold standard. So if the county if Santa Barbara County is able to have such a thing, like when might that occur, and at what level of testing would you feel comfortable about lifting the shelter in place?
Nick can take the question about Lompoc, and then I'll answer your question about testing.
So with regards to the modeling and the timeline, you know, we do anticipate it to occur within the next few weeks regarding the peak. However, we are still refining that model. It's a unique population, which requires some different modeling. So we're hoping to have that information a little bit more finite sometime next week. In regards to the additional patient volume on site in the medical hospital that they're looking to build within the prison grounds, certainly 22 is a great start, and they are very willing and able, and are working with their partners to look to expand that. It's just a matter of scale and need. So they feel that 22 is a good start and meets the need immediately, with the ability to ramp that up to a significantly higher volume should that need arise.
So with regards to, Jean, your question about the ability to protect our communities through testing, I am told that by the end of April, in several weeks, that we can expect to have 5-fold testing capacity in our county. So I'm excited about that possibility. It's a great start. Even then, the Public Health Department is pursuing other opportunities with private partnerships, and again with Sacramento, to increase to acquire as many tests as we possibly can get. And so we want to be at a place where we can broadly test anyone that is symptomatic. And if I may, not only do we need to test broadly anyone that's symptomatic, we really are also planning on our capacity, really maximizing our capacity to do contact tracing, isolation, and supporting those who are positive or exposed. So those are the two tracks with regards to monitoring and protecting our communities.
Thank you, Jean. Did you have any more questions? I think that Jean is gone. We are out of time. If there are remaining questions from media on the phone, please follow up after the press conference by phone. Thank you so much.
Our next press conference will be held Monday at 4:30 p.m. The phone numbers and website addresses of the many information sources about COVID-19 will scroll on the Channel 20 television screen after the press conference ends. Thank you for joining us today.